Take my hand and hold it tight. Look at the paintings, I'll be your guide. Don't stop looking in my eyes. Are you cold? Do you want to sit down? I've been here a million times, so I know my way around. Don't stop looking at me now. I know you don't care as much as I do, but I'm just content with me next to you. Let's go to an art museum, I'll explain it at the coffee shop. I know you don't get it, but there's no need to fret it. It's like a gift, it's about the thought. Monet might be too much, and Van Gogh might take a while. Thank you for coming, I know that you're trying to do anything to make me smile. I'll have a cup of tea while you have a latte for both you and me. The caffeine will make sure that you don't fall asleep, 'cause darling, you're sleepy, eyes are closing.
Hi friends! Today is the day before day 14, which means I'm heading back to work tomorrow, and I want to give everybody a 2-week update on how I'm doing. So at day 7 was really the big turnaround date for me. Day 6 in my previous video, I was really trying to like jump the gun by returning back to normal activities like going to the store or like, you know, doing regular things, because I was stuck at home for a whole week and I was just getting cabin fever. So day 6, I totally went to the MoMA and tried to buy like these planters and just be outside for 2 hours. When I got back, definitely my energy just totally dropped. I had to like take a huge nap. I think that was like the signal that I wasn't 100% of energy yet. So the next day, I just kept pushing hard like every day to get more physical activity in, even if I'm tired. And I think that really helped so much how fast I got better. So every day it's just been really good and chill from the last second half of my break, which is like, you know, day 8 up to day 14. Every day I just felt more and more like my old self, except for like this weird arm disability thing right now, which will take more time to recover. So my scar has started to like have more pulsating feeling, but I was able to have all of my arm and neck movements back. And other than like having a little bit of a hard time holding or carrying something pretty heavy, I would say, you know, everything's pretty good and back to normal, well, which is really shocking. And as you can hear, my voice as well is pretty good. I still have like sometimes a scratchy throat that when I take a cough drop, I'm totally fine. But yeah, my voice itself, I feel like the strength of air coming out and I speak normally, as you can tell. That's actually pretty surprising, and I'm shocked how well that's definitely recovered. In terms of more about the details of, you know, like my mental health, definitely when I went in for the surgery for the first time, I was really, really scared because I've never had a surgery before. And I will tell you, by the time I got home at 2 a.m., I just felt a sense of huge relief. Like I felt like I got it done, it's over now, and I'm at home and everything will be fine. I just had so much weight off my shoulders. And right now, after a week, I just feel so much positivity, especially from remembering all of your messages, gifts, words of encouragement and strength. I think really have definitely changed my mindset 180%. I just feel so much stronger now, and I'm actually less scared overall for my next surgery. I feel so much more confident that I will be able to get through anything. I've done the surgery before and I can take this on and my body will heal, and my mental health in terms of feeling positivity that I'll get through anything in life is at an all-time high now, as opposed to before. I was trying really hard to keep calm and be patient. So I have to say, like, I will credit everything to all of you guys helping me and sending me words of support. So thank you so much. It means the world to me that you've anyone that's reached out. So this morning I was trying to seize the day. There's one more day left of my quote break. So finally I went to get a haircut and get my hair done, so it made me feel a little bit better. Like I haven't had my hair done or getting fixed since October, which I had so much white hair up here that, I don't know, I just felt so bad and gross. And having my last day off, I just thought that would be nice pick me up for my spirits. This morning, I actually went in for my 2-week post-op checkup. So I met with a nurse practitioner and we went over my cancer pathology report, which is the report of what they have found after they've taken the thyroid out. There's some really good news. The really good news is that originally they were sizing up the nodule to be about 1.9 centimeters, which is a little less than 2 centimeters. And the actual cancer cells was inside for about 1 centimeter. So it was actually really small. And there has not been any spread to my lymph nodes, to other regions of my thyroid area, which is a huge relief and probably the best outcome I could have gotten. Which means that I don't need to undergo further medical treatment right now, which is like any radioactive iodine or chemotherapy, and I don't need surgery or further surgery on my throat, which is just so amazing news. And there is something else that they have processed, which is that the rest of my remaining thyroid shows something called a patchy chronic lymphocytic thyroiditis. And I got clarification on this today, which I tried to Google this phrase. And when I Googled it, it sounds like it's linked to something called a Hashimoto's disease, which is an autoimmune disease issue, which is basically saying that my own white blood cells are somehow attacking my own thyroid. And that could be a reason why this has happened, which in terms of management of autoimmune disease, I would probably need the thyroid medication, which is exactly what I expected and what the outcome is. So 4 weeks till the testing will start. So it's gonna be another 2 weeks, I think, which will be the 23rd of this month. I will need to do a couple of thyroid tests, which will determine to see how much medication I would need and what is the amount of T3, T4 that I'm missing from my body. As you know, like thyroid controls your metabolism and vitamin deficiencies, so they're probably gonna give you medication to kind of help with this. Blue's really mad right now. They're going to probably give you medication to make sure that all of that is under control and where was I? Yes, so I have to see an endocrinologist going forward on a regular basis and do the testing, because the amount of the thyroid medication is a trial and error. So they'll start giving it to you, and the medication needs to be balanced. It needs to be, can't be over or under, otherwise you will have hyper or hypothyroidism. So prior to this surgery, my blood work does not show that I need a thyroid medication at all. Like if I don't have hypo or hyperthyroidism, so hopefully the medication can be done perfectly, so I don't have to like get through any of those possible symptoms. So I think the next video that I'm going to make about thyroid will be at the testing stage and just give an update at end of the month. So yeah, I guess that will end my current, post-surgery vlog. And once again, thank you guys so much for all your words of support and your prayers and thoughts for me. Thank you so much. Oh yeah, I forgot one last thing. The doctor told me that he prefers this product called Scarway strips and gel, where you could apply the strip, which is like a band-aid, on your scar area, and also the silicone gel daily to kind of ease out the scar tissue. Also, I have to apply sunscreen about SPF 50 on the scar for more than a year, and the scar should not see the sun. So that's kind of like the post-op care at this moment. Blue.